Hello and welcome to this UCN Vishesh program. I am calling it Vishesh because it is a special program. Special because there are two eminent doctors on the panel today, and we'll be talking about a very important topic called as heart and its related ailments, etc. I take this opportunity to request Dr. Patil, who is here, and he is the director of Sri Swami Samarth Hospital and Multi-Speciality Hospital. He will be coming talking about Dr. S.Ramaswamy, who is come from Chennai here, and he will be talking about him. So I request you, sir, to please introduce Dr. S.Ramaswamy.
Hello UCN viewers. First of all, wish you a happy and prosperous new year. Today I am very lucky and honored to have two mentors of my life. Mentors is a person who sees what others cannot see, and they navigate the life of their disciple in such a way that he blossoms like anything. So the first mentor of my life is Mr. Sharma. He taught me in 1985. I used to bunk other classes but attend his classes. So that makes me lucky today to have him as a person who is going to take interview of mine. The second mentor of my life is Dr. Ramaswamy. He came in my life in 2004. And he taught me non-surgical treatment EECP. From there onward, he navigated my life to success and blossomed my life like anything. Today, whatever I am, the hand of Dr. Ramaswamy is very much, because he supported me on every steps and guided me. Dr. Ramaswamy sir is a kind-hearted and a noble person. He is the director and CEO of Heal Your Heart Center. Heal Your Heart Center is situated in Chennai, and it has branches all over India.
Even on the globe, would say?
Yeah. No.
Globally?
All over India.
Okay. Thank you for those compliments, sir, that you paid to me at the start of the program. If I could start with you, sir.
Yes, sir.
What brings you here to Nagpur?
Today I had a good opportunity. In fact, I am very happy and pleased. I was invited by Dr. Pradip Patil that is starting his EECP center. In fact, he started the center in 2004, if I am right. And from that, stage by stage, he picked up from one mission, second mission and third mission. And today I am very happy with him to inaugurate his fourth mission in the same place.
So nice.
That's a very wonderful news, because not many people in India could be able to do it. The maximum seen is 2 to 3 missions.
But he has 4.
He has 4, I think.
It must be a record also.
Yes, I think in this area, I think it would be the first largest EECP center in this Vidarbha, or I would say even in...
So before we start, I would like to request you to say something about your educational journey, which I heard was full of hurdles.
Yeah, actually I started my medical education in Karnataka, Davangere. And then after finishing my Davangere, I came back to Chennai and I did my housemanship in Stanley Medical College. And after that, I moved on to Pondicherry, and there I did my senior residentship. And after that, I took my exam, USMLE, and I went to US. There in US, I started my residency program. That's what I went for. But actually, I took a fellowship in clinical cardiology in Portchester University. And there my interest took a turn. I was looking at various treatment for heart disease. In that, I got quite impressed by a new emerging technology that time. It's called enhanced external counterpulsation.
When was that, sir?
This was in 1999 and 2000.
Okay.
So, in fact, I was involved in this project that the first commercial EECP system in the world was initiated in Portchester University that time. So, I was a fellow there and I started working on that under my chief mentor, who is called Dr. Tattaglia. So, I was so lucky that this new concept, when was being originating in US, I am one of the pioneers to even start up the project in the US itself.
So nice. Dr. Patil, what would you like to say something about this Sri Swami Samarth Heart Care and Multi-Speciality Hospital, Trimurti Nagar?
श्री स्वामी समर्थ हॉस्पिटल ये जो है ये नॉन सर्जिकल ट्रीटमेंट हार्ट के ब्लॉकेजेस का करता है 70 to 100% हार्ट ब्लॉकेजेस का, और जो कमजोर हृदय हार्ट फेलियर पेशेंट्स का उनका ये ट्रीटमेंट बिना ऑपरेशन के करता है। आज 2004 से हम लोग ट्रीटमेंट कर रहे हैं, करीब करीब 4000 के ऊपर पेशेंट हो चुके हैं। राइट फ्रॉम स्टार्टिंग, फ्रॉम फर्स्ट मशीन, यानी एक मशीन आई, फिर 2 मशीन आई, फिर 3 मशीन आई, अभी 4थी मशीन हम लोग लॉन्च कर रहे हैं। सो नाउ इट हैज़ बिकम द बिगेस्ट सेंटर, जहाँ पे पेशेंट अपने तकलीफें लेके आते हैं और हार्ट की तकलीफ लेके आते हैं, तो उनको हम लोग बिना ऑपरेशन के ट्रीट करते हैं, तो बाद में खुशी खुशी अपने घर जाते हैं। तो इसमें हमें संतोष बहुत होता है।
जी सर, आपने एक टर्म यूज़ किया, हार्ट फेलियर। तो बिफोर यू embark upon these things, these points, EECP etc., मैं चाहता हूँ कि either of you could just say what are these terms: heart failure, heart attack, cardiac arrest, myocardial infarction, then angina. These terms quite often are confusing.
So it's interesting. I mean, you put all that concept in a single question, and see, heart is an organ which start pumping from the day you are born until you die. So it keeps pumping every day. So when it start pumping, it's required blood supply for itself. Right. That blood supply is provided by what we call as coronary arteries. So these coronary arteries continuously nourish the heart muscle, which is called myocardium, with oxygen and with nutrition. So sometimes when these coronary arteries are obstructed or blocked, then the nutrition is not able to reach the heart muscle. So when the nutrition is not able to reach the heart muscle become ischemic, or it become lack of blood supply. Now this is where the patient get the chest pain.
Right.
So what they say is, doctor, I'm okay, but I'm going to start doing something, I get discomfort. So it shows the blood supply is not adequate enough to have a complete heart functioning.
Right.
So this is called chest pain. Now, if you ignore this and you keep going on and on, some one point of time, this obstruction become 100%. Now what will happen? The blood flow is completely stopped. Now this leads to what we call as a heart attack, which is called myocardial infarction. So the heart muscle, without getting enough blood supply, slowly and eventually it dies. So death of the heart muscle is called heart attack or myocardial infarction.
How much time do you get, sir, if you come across such a situation?
See, I mean, usually
to save a heart attack person.
Yeah, this is very important because its time is muscle. So when you have a chest discomfort which is not relieved with taking rest or taking some medicine, immediately you should go and go to a nearby hospital. At that time, if they can able to give you some drugs and dissolve the blocks, which we call as thrombolysis, or we can able to open up the vessel, then we can able to prevent a heart attack.
Okay.
So the decreased blood supply to heart attack. So this is a time period which we can able to save the muscle.
Right.
Sometimes this is called heart attack. Another point you brought it was cardiac arrest.
Arrest, yeah.
And now you have seen in many times young individual doing exercise, suddenly they fainted, suddenly they got a cardiac arrest and died.
We had recent examples, KK, Raju Srivastava.
Yes.
Yeah.
Now this is a separate entity. Now so far we spoke about myocardial infarction or heart attack. Now cardiac arrest is another entity. Now as I was talking about the blood flow to the heart muscle, there is also another circuit. This is called the electrical impulse. Because as you know, everybody know heart pumps in a rhythmic fashion, looped up, systole, diastole, systole, diastole. To the rhythmic function of the heart is directly depend upon the electrical signal. So sometimes these electrical signals are interrupted or suddenly stops. When the electrical impulse stops.
What could be the reason for interruption?
There are so many causes, but the more common causes, again I go back to the lack of blood supply. So, or it can be an inherent problem. Suddenly, it's like a circuit. You have a circuit break. You don't have many times you don't know the reason. Suddenly the circuit stops. Similarly, the electrical impulse stops. Even without the blood, even when there is a normal blood flow also.
That could be a rare case.
Yes. And when that happens, electrical impulse is stopped. It's called cardiac arrest because you don't have any time now. The heart stops immediately. When the heart stops, within 1 to 2 minutes, death naturally ensures. So this is called cardiac arrest. And then you spoke about heart failure. Now many times when the lack of blood flow is so severe, the heart muscle will stop functioning as it's supposed to be.
Okay.
So instead of contracting with much force, the force is lost. So it is contracting with less force.
So the efficiency is affected.
Very good. Yes, the efficacy of the heart muscle is not adequate for your routine requirement. Your routine requirement is what? You need to go to your bathroom, take a bath, or walk for 10 minutes, 15 minutes. It should not cause any trouble. But when the heart muscle is not pumping as much as supposed to be,
Its capacity.
and then it is called heart failure. So it is actually a misnomer. Heart failure doesn't mean your heart has failed.
Failed.
It only means your heart is not functioning as it is supposed to be.
But it could lead to an attack.
Yes, if you have a heart failure, it means sometimes you already had an attack. Because of that, your heart is failing.
Okay.
And people with low pumping function are at higher risk of again getting a heart attack and again getting rehospitalization because of breathing trouble. So when the function of heart comes down, there are a lot of things can happen to you, lead to your hospitalization.
Okay. Then what is refractory angina? And this is also again a term.
Yes, and refractory angina is, see, when you talk about chest pain, then there are a lot of options available to you. You have a medicines. So you give certain medication, you can improve the cardiac function and improve the symptoms. If the medication doesn't relieve, then you have other alternative high risk procedures like a bypass surgery or angioplasty, or now what we are going to talk about is EECP. These are all the options which is available when the medication fails and you go for an interventional procedure. Many times, interventional procedure is not a permanent solution. People should understand it. When they go for a bypass surgery or angioplasty, they are not getting cured. They are improved palliatively. So what happened, even irrespective of this patient under medical management, they have gone for a bypass or an angioplasty, still they may get chest pain. So this is called refractory angina.
सर, जिस मुद्दे पर सर ने कहा और आप लोग आए हो इस स्टूडियो में, वो है EECP. तो श्री स्वामी समर्थ हॉस्पिटल में EECP कितने हैं, क्या काम है उसका और कैसे वो एक पेशेंट को हेल्पफुल रह सकता है?
EECP ये जो मेथड है, ये नॉन सर्जिकल है, बिना ऑपरेशन के हार्ट पेशेंट्स का इलाज करती है. इसमें क्या होता है, एक पेशेंट को बेड पे लिटाया जाता है और बेड एक स्पेशली मेड रहता है जिसके अंदर में न्यूमेटिक कप्स रहते हैं. वो पाँव, मांडी और कमर को बांधे जाते हैं और फिर बाद में उसको ECG लीड लगाया जाती है पेशेंट को और ECG वहाँ पे कंटिन्यूस मॉनिटर होता है. उसके बाद में सीक्वेंशियल इन्फ्लेशन एंड डिफ्लेशन होता है कफ्स का. पहले काफ, फिर थाइस और फिर बटक्स, और नीचे से जो प्रेशर है उसके द्वारा जो ब्लड जो हमारा वापस ऊपर आ रहा है, दैट इज कॉल्ड वीनस रिटर्न, उसको कोरोनरी आर्टरी में अशर किया जाता है. सो ब्लॉक्ड आर्टरीज के अराउंड ब्रिज बन के रास्ता ओपन होता है एंड इसके अलावा कोलैटरल सर्कुलेशन भी डेवलप होता है. तो हमारा जो एम रहता है सर्जरी का या एंजियोप्लास्टी का, कि हमारे हार्ट को ब्लड फ्लो मिलना चाहिए. तो इधर वो सर्जरी से मिलता है.
What's the normal amount of blood that should be supplied to the heart in a natural process?
225 ml.
Okay.
तो अगर हम लोग एक आर्टरी से, आर्ट्रियोल से एक 2 ml भी पहुंचाते हैं तो हमारे को 125 ही लगने वाले पूरा ओपन अप करने के लिए. बट EECP से हजारों आर्टरीज जो है ना, उनके ब्रांचेस खुल जाते हैं. अगेन देयर इज एंजियोजेनेसिस आल्सो, मतलब फॉर्मेशन ऑफ न्यू ब्लड वेसल्स. तो ये जो नए ब्लड वेसल बनते हैं, ये अपना पाथ जो है मजबूत रखते हैं, तो ये लॉन्ग लाइफ चलते हैं. तो इस प्रकार से जिस पेशेंट में अपनी शिकायत रहती कि बाईपास बताया हुआ, एंजियोप्लास्टी बताया और अभी ब्लड फ्लो नहीं हो रहा, चेस्ट पेन हो रहा, अंजाइना हो रहा, ब्रेथलेस हो रहा, तो वो सब सिम्टम्स हमारे यहाँ पे रिलीव हो जाते हैं.
जी सर, आपने कहा कि आपके हॉस्पिटल में ऑलरेडी 3 EECP मशीन्स हैं और आप एक चौथा लॉन्च करने जा रहे हैं शॉर्टली, थोड़ी देर में. तो क्या पेशेंट्स की इतने वहाँ ये आ जाती है रश कि आपको 3-3, 4-4 EECP मेंटेन करना है?
शुरू में सर हम लोगों ने एक मशीन लॉन्च किए थे.
हाँ.
तब एक मशीन पूरी फुल हो गई, तभी हमारे को नीड हुई कि हम लोगों ने दूसरी मशीन लगवाना चाहिए. अब दूसरी मशीन फुल हो गई, तब
फुल हो गए मीन्स इन व्हाट सेंस?
पेशेंट्स.
अच्छा.
एक मशीन पे कम से कम 11 पेशेंट हम लोग कर सकते हैं, 10 से 11
पर डे.
हाँ. तो 10 का टारगेट एक मशीन पे अचीव हो गया. हाँ. दूसरी मशीन पे 10 का टारगेट अचीव हो गया. तीसरा मशीन भी कंप्लीट कर गया. अब बचे हुए जो पेशेंट थे उनको हमारे को रिफ्यूज करना पड़ता था कि भाई अभी कुछ दिन रुक जा. तो फिर मेरे को ऐसा लगा कि नहीं, हमारे विदर्भ के जो पेशेंट्स हैं उनको मुंबई या दिल्ली या इधर भेजने से अच्छा हम ही लोगों ने इनिशिएटिव लेते हुए सबसे बड़ा सेंटर अपना निर्माण करने का, तो यहाँ पे पूरे पेशेंट्स को फैसिलिटीज मिले ताकि उनका ट्रीटमेंट हो और कोई निराश होकर हमारे सेंटर से न जाए। और
इसी उद्देश्य से आप चौथा आज मशीन लॉन्च कर रहे हैं एंड कंग्रेचुलेशन फॉर दैट, बेस्ट विशेस फॉर दैट ऑल्सो। एक बात बताइए कि जैसे अगर मैं बाईपास कर लेता हूँ या एंजियोप्लास्टी करा लेता हूँ, तो जैसे सर ने कहा इट इज़ ओनली अ टेम्प्रेरी रिलीफ, आगे बढ़ के आ सकता है वो, तो कॉस्ट वाइज अगर हम कंपेयर करें तो EECP जो है ये कितना कॉस्ट इफेक्टिव हो जाता है और ये एज़ कम्पेयर टू बाईपास और एंजियोप्लास्टी कितना वायबल है?
EECP जो है वो चीपर है
हाँ,
as compared to surgical intervention. It is 1/4 the cost of surgical intervention cost. तो इस प्रकार से पेशेंट फ्रेंडली है, डॉक्टर फ्रेंडली नहीं है। इट इज़ पेशेंट फ्रेंडली, नॉट डॉक्टर फ्रेंडली, बिकॉज पेशेंट को इसमें कम पैसे में इलाज हो जाता है।
हाँ, इलाज होता है ना, एग्जैक्टली क्या होता है, जैसे बाईपास से हम ब्लॉकेजेस क्लियर कर लेते हैं या एक अल्टरनेटिव पाथ दे देते हैं, तो वैसा ही इस मशीन से भी कुछ होता है EECP से?
EECP से पेशेंट को जो लैक ऑफ ब्लड सप्लाई रहता है,
हाँ,
जो खून कम हो रहा है सप्लाई हार्ट को, वो पूर्ववत हो जाता है और उसके हार्ट को जितना खून मिलना चाहिए वो मिलना चालू हो जाता है। तो जिस वजह से हम लोग कुछ सर्जिकल इंटरवेंशन करने का सोच रहे हैं, अगर वो पर्पस हमारा सॉल्व होता है EECP से, देन व्हाई शुड वी गो फॉर सर्जिकल इंटरवेंशन?
राइट सर, यू आर अ नॉन इन्वेसिव कार्डियोलॉजी कंसल्टेंट. Tell us something about this heal your heart concept. How did it originate? What was the aim? What was the objective of that?
Well, when I was first working in Portchester University in US, I have a chance to look at the first EECP system in the country in US. So there, when they first started this program as a non-surgical treatment for heart patient, they brought in patients who are very sick. These patients would have gone for a bypass surgery or angioplasty and they failed and they are very symptomatic, which we spoke earlier, called refractory angina. So, under the chief cardiologist Tataglia, I was a resident there, so I had an ability to treat this patient for their heart disease. So, as a first treatment center, I mean everybody is skeptical because nobody have known about the treatment in the entire US that time.
You're right.
So, when I start treating this patient, every day we used to go and start treating the patient for 35 days. The first 10 patients which I have treated, all of them significantly improved on their exercise tolerance. It means these patients who are not able to walk for 5 to 10 minutes without getting chest discomfort, even after undergoing a bypass or angioplasty, when we do this EECP treatment, within this 15-20 days, they improved so significantly, they were able to walk half an hour, 45 minutes without any discomfort.
That's great.
That was a great achievement for that time.
All right.
So, immediately I was thinking that if this technology is so good, why don't we bring it to India? So, I corresponded with the manufacturer because as one of the co-inventor, because I also contribute to the EECP development in US.
Right.
We published various articles to show that EECP indeed improve the blood flow.
Proud to be an Indian.
Yes. So, immediately the manufacturer we worked on, we gave a contract and gave the right to bring this technology to India and to train the doctors here. So, initially I was giving a lot of lectures across India and getting this treatment known to the Indian cardiologist. The first center was started in Madhya Pradesh in People's General Hospital, and then in Fortis Group started the second EECP treatment center. But eventually I believe if I can able to teach doctors, teach physicians how to operate, how to treat the patient with EECP, why don't we ourselves can put up a center which could be of a high quality center in par with any Western country to treat the patient with the same protocol which we have established in US, which got approval by the US FDA as well as all the medical insurance company in US. So, Heal Your Heart is a child which born out of this idea to treat cardiac patient in India.
What's the response like, sir?
I think
all over India, I'm talking in terms of
yes,
India.
In fact, in the past 5-6 years, there was a significant or enormous growth of EECP in India. Right now, I would believe there are around 250 to 300 centers have started in India.
Okay.
This includes, yes, this includes all big cardiac hospital also. Like if I say Medanta Medicity or in Asian Heart Institute, these are all the big institutions. And in Tamil Nadu, Dr. K.M. Cherian Hospital. So, many hospitals started adapting this new technology to treat cardiac patient non-invasively. and without getting hospitalization and more cost effective and safely.
राइट सर कोई भी प्रोडक्ट जब लॉन्च होता है तो जनरली होता है उसका एक प्लस एंड माइनस पॉइंट. तो व्हाट माइनस पॉइंट्स हैव यू ऑब्जर्व बिकॉज यू सेड दैट नंबर ऑफ पेशेंट्स इन योर हॉस्पिटल इज इंक्रीजिंग डे बाय डे. तो इसका नेगेटिव इफेक्ट क्या होता है सर?
नेगेटिव इफेक्ट ऐसे सच तो मैंने देखा नहीं.
हाँ.
हमने पॉजिटिव इफेक्ट ही देखा हुआ है.
सक्सेस रेशियो क्या है सर?
मोर देन 90%.
अच्छा. व्हाट अबाउट द 10%? Because of some other.
Actually, we are treating heart patients. They are already critical. So we are not treating malaria or typhoid. So heart patients are already critical who are having critical blockages. So in that cases, 10% failure is not important issue.
But you are largely successful. Largely successful. Yeah. जब अपन EECP की बात करते हैं सर तो उसके साथ साथ एक टर्म आता है ICS. What is that and how does it relate to this EECP?
ICS is an organization which is international, International Cardiological EECP Society, in which I am the executive committee member. I am in executive committee, and Dr. Ramaswamy is director. I think he will highlight that.
You can continue.
Yeah, ICS is a International Cardiology EECP Society. So the idea to start up a society is we want to bring policies, decision and some guideline for the insurance companies and the government. So we need to make sure this treatment reaches every patient in the country. It has to through some policy decision and through some insurance coverage. In fact, through ICS we are able to get some insurance accept this concept and reimburse the EECP treatment. And also ICS will be doing a lot of clinical research to promote this concept into various cardiology group and across India. In fact, we come up with a proposal to the government of Tamil Nadu. They eventually has given EECP clearance and accepted to reimburse the cost of EECP for all government employees and pensioners.
Okay.
I think it is a first step we have made to incorporate this concept into the government. Okay. State government.
Right.
And in fact, these guidelines become so impressive. In fact, we have given even opportunity by the previous president, Pranab Mukherjee, to treat his wife in Rashtrapati Bhavan.
Okay.
So these are all, yes, these are all we consider as a honor, and I think through ICS we may able to reach the country faster through a society.
Is EECP meant exclusively for heart or there are some other functions which it could take care of?
See, I mean, if you look at heart disease.
I'm asking this because I read somewhere that it is also helpful in erectile dysfunction as well.
Yes, it's a very good point because if you look at heart disease, erectile dysfunction, diabetes, hypertension, hypercholesteremia, these are all lifestyle changes. See, when you have some lifestyle changes, this leads to heart disease. So heart disease is all these changes cumulatively, it create a heart disease. So when you do a treatment for heart disease, it has to increase the blood flow, similar to what exercise does. So if a patient has a high ability to do exercise, they won't have diabetes, they don't have hypertension. Erectile dysfunction is very less in very active individuals. These are all more common in people with sedentary, diabetic, smoking. So what EECP does is it mimics exercise. It increases the blood flow to the heart muscle in such a fashion as if the patient is doing a very, very aggressive exercise, which he couldn't able to do it. So 1 hour of EECP treatment is equivalent to, I would say, around 8 to 9 kilometers of jogging. When that much of flow is improved, naturally it could be used as a preventive tool, as you are saying. It can able to control your diabetes, it can able to control your blood pressure, it can able to control your hypercholesteremia. It has a significant improvement of people with erectile dysfunction. So all these things is similar to what an exercise can do. So EECP, it not only treat the heart disease, it also able to target all other risk factor which can lead to heart disease.
Right. सर 2030 तक इंडिया एक लीडिंग वर्ल्ड कैपिटल बन जाएगा हार्ट रिलेटेड प्रॉब्लम्स में. डायबिटीज़ में तो हम है ही आगे. तो इन चीज़ों को देखा जाए अगर हार्ट के एलिमेंट्स को, तो कहीं ना कहीं डायबिटीज़, ओबेसिटी या कोलेस्ट्रॉल या बीपी, हाई बीपी ये सब फैक्टर्स इन्वॉल्व हो जाते हैं और दैट लीड्स टू हार्ट अटैक और हार्ट एलिमेंट्स. तो व्हाट इज योर टेक ऑन दैट?
My message is simple. Attack the enemy before it attacks you. So simple.
You need to be
Attack the heart
offensive.
attack before it attacks you. So we have to modify our lifestyle such that we should eliminate tobacco, smoking, drinking, non-veg, oily foods, then samosa, kachori, pakodas, and all this we have to eliminate to make our life healthy and also heart healthy. So attack the heart attack before it attacks you.
Yeah. What role does alcohol play? Either of you could answer it, because we hear that alcohol should be consumed only at 30 ml per day, and people never drink 30 ml.
Yeah, I was just going to tell, 30 ml is never the last 30 ml of the alcoholic. One who takes alcohol, so he goes on taking alcohol.
Yeah.
So ultimately he becomes addicted to that. So it's not nice on any part.
Yeah. Again,
Even if doctor suggests you take 60 ml, no doctor suggests. But that 60 ml is not the last 60 ml. It goes on.
It goes on. Yeah. So any suggestions for that? How to change it or discard it from your life?
Determination. Once you decide to do something, then it is finished off.
क्योंकि हमने देखा इंडिया में कई सारे अल्कोहलिक एनोनिमस organizations, and once they come out of that organization, again they stoop back to their own practices.
I think it is in mind. When one makes
A firm decision.
determination, then nothing can stop you. Neither tobacco, nor smoking, nor this drinking.
How did you get acquainted with Dr. Ramaswamy, sir? Of course, the fact that he was a mentor.
It's a very tricky question, but I will tell you. We all are here because of some mighty force. I believe in God because of God's grace and God's blessing and Swami Samartha's blessings. I came in contact with you also. I am not forgetting you in my life. He came in my life, and at that time I was in very much doldrums. I think God might have sent him to guide me and move ahead.
Get you the right path.
Yeah. I just mentioned before that mentor is the one person who sees the other qualities in the person whom others cannot see. And he guides or saves the disciple's life in such a way that he becomes he is on top of the world now.
Right. So this is a comparatively new mode of treatment, EECP. Does the staff of any hospital, say, require a special training or such special session for that?
Yes.
And what is the duration like?
That's what we created, the International Cardiology EECP Society, ICS. So what we do is the physician need to get training. So if the physician already has a background training in cardiology a little bit, then we take them for a 14 days course where they will be trained on how to handle the patient, medication, how to operate the machine. And we also have a therapist program. So you think about a dialysis. See, if you are the dialysis, it is a nursing who is going to do the dialysis, and the nephrologist is not going to be there all the time. So he is going to monitor. Similarly, EECP is driven by a physician champion who know how to operate the machine, how to run a program, and also it's run by a clinical therapist. So we have a specialized clinical therapist course also. It is for a 2 months course.
2 months.
So they come here and spend time with us in Chennai in our center, and at least they have to treat at least 30 to 40 patients to get a credit score. After that, we conduct a small examination. After clearing them, they get certified.
Okay. So that no special training as such. It's only an interaction with you people to get it.
Yes, and directly they also will ask them to treat patients. So what they will go undergoing a training is a treatment center.
Dr. Patil was great enough to acknowledge that he had two gurus, you and me, in his life. Tell me, who was the person responsible for your success and who was it behind you?
See, I mean, as he said, it is your acquaintance with whom you are going to acquaint. In US, when I first went, I had an opportunity to meet two big names. One is Dr. John Yui, who is a founder of this EECP concept in US. So, I just met him in a small dinner mat. So, I was talking about EECP. I said, I heard about this EECP. I was the first guy to treat the patient. So he was so impressed and he asked me like, do you like to work on this? So I said, yeah, I have enough time, I can work on that. So that started a collaboration with me and Dr. Yui, who is actually who brought this EECP concept or originated this concept in US. And then I also had an acquaintance with Dr. John Joseph Tattaglia, he's an Italian cardiologist. Under him, he is a non-invasive cardiologist. And he was the one who is involved in this project EECP as a program director.
And behind your success.
Yes. And of course, without family members' involvement, nobody could reach any success.
Right.
So with all that, I think I was in the right place at right time. That's it.
Of course, the saying goes that behind every successful man there is a woman.
Yes.
Here, what role did Madam play?
Of course, I mean, my wife, she is a dentist. But when I first set it up this unit, she thought like she can able to contribute more to my center. In fact, she stopped practicing dentist and helped me to build up this Heal Your Heart. And I think without her, I would not have placed so many centers.
Sir, एक कहावत है कि if Muhammad can't go to the mountain, let the mountain come to Muhammad. ये एक पुरानी कहावत है. तो आप कहीं अवेयरनेस कैंप्स या सेमिनार्स वगैरह कंडक्ट करते हो, क्योंकि आपके हॉस्पिटल के बारे में इट नीड्स टू बी पॉपुलराइज्ड बाय अवेयरनेस कैंप्स.
हम लोग हर महीने में 1 या 2 अवेयरनेस कैंप जरूर करते हैं. इसमें हम लोग शुगर, ECG, देन लिपिड प्रोफाइल, कभी कभी यूरिक एसिड, कभी कभी थायराइड फंक्शन टेस्ट, ये हम लोग करते हैं. और ECG वगैरह तो हमारे सेंटर में फ्री ऑफ कॉस्ट होता है. इसके पीछे में मैं एक चीज कहना चाहूँगा कि ये मेरा ऋण है जो मेरे पिताजी ने मेरे को डॉक्टर बनाया. तो पूरा फाइनेंस मैं करता हूँ. एवरीथिंग इज फाइनेंस बाय मी. सो मेरे को उसमें खुशी होती है कि जो माँ बाप ने मेरे को डॉक्टर बनाया, तो किसी पेशेंट को या किसी इंसान का डायग्नोसिस हो सके और फिर आदमी उसको एक प्रॉपर पाथ मिले. हर कोई इतने महंगे क्या बोलते हैं उसको इन्वेस्टिगेशन अफोर्ड नहीं कर सकता. तो वो कैंप जरूर हम लोग करते हैं, अवेयरनेस करते हैं. और हम लोग ये बताना चाहते हैं कि स्टिच इन टाइम सेव्स 9. इसका मतलब होता है कि अगर हमारा
समय पे ही इलाज हो,
समय पे ही अगर हम लोग एक स्टिच करें तो हम लोग 9 से बचते हैं. समय पे अगर हम लोग इलाज करें तो हम लोग बड़ी व्याधि से बच सकते हैं. सिमिलरली प्रिवेंशन इज बेटर देन क्योर. अगर हम लोग हार्ट अटैक या हार्ट डिसीज आने ही न दे ये कोशिश करें तो इससे बेहतर तो कुछ नहीं हो सकता. हम लोग वी शुड थिंक दैट वी शुड पुट द पेशेंट्स ऑन सच ए वे that way leads to 0 heart attack path. We can eliminate many things from his life. We can avoid his sedimentary lifestyle. We can avoid his smoking tobacco.
Correct.
We can ask him to walk minimum 35 to 40 minutes per day. Again, we can ask him to be stress free, because stress, we can find out the reason of stress and try to eliminate that reason. So stress free life also is good. Again, we can ask him to cut down oily things in his life. So that wise we can modify many factors which will lead to healthy heart.
Sir, you taught us indirectly to step out of the traditional box and think something out of the box, and you are fairly successful. What is your future missions?
See, I think this new concept which I have introduced, the EECP, could have an enormous impact in India, because the concept of treating heart disease has become so complex and people started so much fear. So once you have a heart disease, there are so much fear is involved. Now let me put it very simply in 2 categories. The treatment of heart disease is only 2. One is palliative, another one is curative. Now all your high risk and very expensive procedures like bypass surgery and angioplasty will come under palliative care. Only a small segment, this bypass and angioplasty, can be curative. So 80 to 90% of them, the curative part comes from lifestyle changes, sugar control, pressure control, and then increasing the blood flow to the heart muscle. So as a EECP would slowly, I would think, will emerge as a primary treatment procedure for patient with heart disease. So if you have a heart disease, go and change your lifestyle, control your risk factor and start up with a EECP treatment. If you do that, as Dr. Pradip Patil also has mentioned, 90% would not progress into going for a bypass surgery and angioplasty.
Right.
If this can be achieved, the cost benefit or the cost saving for the nation and the insurance and the individual family would be a huge.
That's great thinking, very great thinking.
That is what we should achieve with this concept.
We are running out of time, sir, so I would just like you to give a message from Swami Samarth Hospital. What could be that?
Prevent heart attack and reverse heart disease. This is the best message which I can give.
In short and sweet.
Yeah.
What's your message, sir?
My message is, if you have a heart disease, don't get afraid of it. And heart disease is easily treatable, and it is very simply can be able to achieve through lifestyle changes. And now we have a new concept, enhanced external counterpulsation, which is also non-invasive.
Right.
So you have to take the fear out of heart disease, and that's the message I want to give.
Very nice, sir, very nice. Thank you very much for joining us on this panel. It was a pleasure talking to both of you. Thank you very much.
Thank you. Thank you.